Welcome to today's video about symptoms of urinary tract infection. Have you ever noticed how some of the most common infections can disguise themselves as something completely harmless? Something as simple as fatigue, cloudy urine, or even confusion. Most people would never guess these could be signs of a urinary tract infection, but here's the twist. Over 400 million people worldwide suffer from UTIs each year, and many of them don't even realize it until things get worse, sometimes dangerously worse. According to the World Health Organization and recent clinical studies, UTIs are not only common, they're becoming more complex, more resistant to treatment, and more easily overlooked than ever before. Now ask yourself, how many people do you know who've complained about frequent urination, strange-smelling urine, or unexplained pelvic pain and just brushed it off? What if those seemingly small signs were actually your body sounding the alarm? Here's where it gets real. We're about to dive into the top symptoms of urinary tract infections, including some that doctors say are commonly missed, even in ERs, and you might be shocked by what's on this list. One of these symptoms can show up without any pain at all, and it's often mistaken for something completely unrelated. Stick around until the end of the video, because we're not only breaking down these symptoms, you'll also learn how to spot the early warning signs before the infection gets serious. If you're new here, welcome. Hit that like button and subscribe, because every week we bring you research-backed, real talk about your health that you won't find in typical medical commercials. And hey, tell us in the comments, what country are you watching from? We'd love to know how far this message is reaching. Let's raise awareness together. Your health deserves this knowledge. Let's begin. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. All right, kicking things off with the very first symptom you need to watch for. Burning sensation in the urethra. That burning sensation when you pee? It's not just in your head, it's your body's way of waving a red flag. This discomfort, known as dysuria, is often the first sign of a urinary tract infection. Here's what's happening. When bacteria, like E. coli, sneak into your urinary tract, they latch onto the lining of your urethra. This invasion triggers inflammation, making the urethra sensitive. So when urine passes through, it irritates the already inflamed tissue, causing that unmistakable burning feeling. A comprehensive review in the American Family Physician Journal, 2015, highlights that dysuria is a prevalent symptom of UTIs, especially in women. The article emphasizes that this burning sensation is a key indicator, often prompting individuals to seek medical attention. The review also discusses the importance of distinguishing dysuria caused by UTIs from other potential causes, ensuring accurate diagnosis and treatment. If you're experiencing this burning sensation, it's essential to consult a healthcare provider. They can perform a simple urine test to confirm if it's a UTI and recommend appropriate treatment. Ignoring the symptoms can lead to more severe complications, so don't hesitate to seek medical advice. Next, number 2, frequent urge to urinate. Ever felt like you just went to the bathroom, but suddenly you need to go again? That frustrating, frequent urge to urinate, especially when it's urgent and hard to ignore, can be one of the clearest signs your body is fighting a urinary tract infection. Here's why it happens. When bacteria like E. coli invade your bladder, they irritate the bladder lining. Now imagine your bladder as a balloon. Even if it's barely filled, the irritation makes it feel like it's about to burst. Your brain gets the signal, go now, even though there's barely any urine inside. It's not just in your head, it's your body reacting to inflammation. Recent research backs this up. A 2023 study published in the journal Clinical Microbiology and Infection found that UTI patients reported increased urinary frequency, often paired with discomfort. That's a huge number. And the research showed that even mild infections can cause this urgency because the bladder's nerve endings become super sensitive. Think of it like a false alarm system going off again and again. It's annoying, uncomfortable, and very real. If that constant need to pee comes out of nowhere, especially if it disrupts your day, it might be time to consider what your bladder is trying to tell you. Next, number 3, cloudy urine. Ever noticed your urine looking cloudy and wondered why? That haziness can be more than just a quirk. It might signal a urinary tract infection. When bacteria invade the urinary tract, your body's defense mechanisms kick in. White blood cells rush to the scene to combat the intruders. As these cells accumulate, they can mix with the urine, giving it a cloudy appearance. This phenomenon, known as pyuria, is a common indicator of UTIs. A 2019 study published in Scientific Reports highlighted that urine cloudiness, or turbidity, is a significant predictor of uncomplicated UTIs. The research found that the presence of white blood cells and bacteria in the urine contributes to this cloudiness, reinforcing its diagnostic value. However, it's essential to note that while cloudy urine can be a sign of a UTI, it's not definitive on its own. Other factors such as dehydration or certain foods can also cause urine to appear cloudy. Therefore, if you notice persistent cloudiness, especially accompanied by other symptoms like burning during urination or frequent urges to go, it's advisable to consult a healthcare professional for a proper diagnosis. Next, number 4, strong-smelling urine. Ever noticed your urine smelling unusually strong or foul? That distinct odor might be more than just a quirk. It could be a sign of a urinary tract infection. When bacteria like Escherichia coli invade the urinary tract, they metabolize compounds in the urine, producing volatile organic compounds. These VOCs are responsible for the strong, sometimes unpleasant smell associated with UTIs. Interestingly, a study published in Scientific Reports in 2020 highlighted that these malodorous compounds, including ammonia and other biogenic amines, are byproducts of bacterial activity in the urine. However, it's essential to note that while strong-smelling urine can be a symptom of a UTI, it's not a definitive indicator. Other factors such as dehydration, certain foods, or medications can also alter urine odor. Therefore, if you notice a persistent change in your urine smell, it's advisable to consult a healthcare professional for a proper diagnosis. Next, number 5, pelvic pain. Pelvic pain during a urinary tract infection isn't just a dull ache, it's a signal from your body that something's off. Imagine your bladder as a balloon lined with sensitive nerves. When bacteria like E. coli invade, they don't just irritate the surface. They can trigger an inflammatory response that makes these nerves hypersensitive. This hypersensitivity means even a small amount of urine can cause significant discomfort, leading to that persistent pelvic pain you might feel. Recent research has shed light on this phenomenon. A study published in Brain Behavior and Immunity Health in 2025 found that UTIs can alter the function of bladder nerves, making them overly responsive. This means your bladder might send pain signals to your brain even when it's not full, explaining the discomfort you feel in your pelvic region during a UTI. Understanding this mechanism is crucial because it emphasizes the importance of addressing UTIs promptly. Ignoring the pain or delaying treatment can lead to increased nerve sensitivity, making future infections more painful and harder to manage. So, if you're experiencing pelvic discomfort, it's essential to consult with a healthcare professional to determine the cause and receive appropriate care. Next, number 6, painful ejaculation. Experiencing pain during ejaculation can be distressing and is often linked to urinary tract infections. When bacteria invade the urinary tract, they can cause inflammation in areas like the prostate and urethra. This inflammation can lead to discomfort during ejaculation. A study published in the Translational Andrology and Urology Journal highlights that infections such as prostatitis and urethritis are common causes of painful ejaculation. The research emphasizes the importance of recognizing this symptom as a potential indicator of underlying infections. It's crucial to consult a healthcare professional if you experience such symptoms. Early diagnosis and treatment can prevent complications and improve quality of life. Next, number 7, blood in the urine. Imagine noticing a pink or reddish tint in your urine. It's unsettling, right? This discoloration, known as hematuria, can be a sign of a urinary tract infection. When bacteria invade the urinary tract, they cause inflammation and irritation. This irritation can damage the lining of the urinary tract, leading to bleeding. As a result, red blood cells may leak into the urine, causing it to appear discolored. There are 2 types of hematuria, gross and microscopic. Gross hematuria is when you can see the blood in your urine, making it look pink, red, or brown. Microscopic hematuria, on the other hand, is not visible to the naked eye and is only detected through a urine test. A 2024 study, published in the International Journal of Reproduction, Contraception, Obstetrics, and Gynecology, highlighted a case where a pregnant woman developed gross hematuria due to a UTI-induced bladder hematoma. This case underscores how UTIs can lead to significant bleeding in the urinary tract, even in the absence of other typical symptoms. If you ever notice blood in your urine, it's essential to consult a healthcare professional promptly. While UTIs are a common cause, other conditions can also lead to hematuria. Early diagnosis and treatment can prevent complications and ensure your urinary tract stays healthy. Next, number 8, Lower abdominal discomfort. Lower abdominal discomfort during a urinary tract infection isn't just a random ache, it's your body's way of signaling that something's off. When bacteria enter the urinary tract, they can irritate the bladder lining, leading to inflammation. This inflammation often manifests as a dull, persistent pain or pressure in the lower abdomen, just above the pubic bone. This sensation arises because the bladder, located in the lower abdomen, becomes inflamed and sensitive due to the infection. As the bladder fills and stretches, the inflamed tissues can cause discomfort or pain. This pain is typically felt in the suprapubic area and may intensify as the bladder fills or during urination. A recent study published in Stat Pearls, 2024, highlights that suprapubic discomfort is a common symptom in uncomplicated UTIs, emphasizing the importance of recognizing this symptom for timely diagnosis and treatment. Understanding this connection between lower abdominal discomfort and UTIs can help in early detection and prompt treatment, preventing the infection from progressing to more severe stages. Next, number 9. Pain in the side or lower back. Imagine waking up with a dull ache in your lower back, thinking it's just a muscle strain. But as the day progresses, the pain intensifies and you start feeling feverish. This isn't just ordinary back pain. It could be a sign of a urinary tract infection that's moved up to your kidneys. When bacteria from a UTI ascend to the kidneys, they can cause inflammation known as pyelonephritis. This inflammation often results in pain on one or both sides of the lower back, just below the ribs. It's not the sharp pain you'd associate with a pulled muscle. It's a deep, throbbing discomfort that doesn't go away with rest. A study published in the Journal of Osteopathic Medicine in 2021 explored this connection. Researchers found that patients with UTIs often experienced reduced kidney mobility, which contributed to persistent low back pain. By applying manual treatments to improve kidney mobility, many patients reported relief from their back pain. So, if you're dealing with unexplained lower back pain, especially if it's accompanied by symptoms like fever or frequent urination, it's essential to consider a UTI as a potential cause. Addressing the infection promptly can not only alleviate the pain, but also prevent more severe complications. Next, number 10, fever and chills. When your body detects an infection, it often responds by raising its temperature. This natural defense mechanism helps combat invading bacteria. In the case of a urinary tract infection, especially when it progresses to the kidneys, a condition known as pyelonephritis, this response becomes more pronounced. The body's immune system releases chemicals to fight off the infection, leading to systemic symptoms like fever and chills. A recent study published in Scientific Reports, 2022, examined 285 patients hospitalized with bacteremic UTIs. The findings revealed that 81.8% of these patients experienced fever or chills upon initial presentation. This high percentage underscores the significance of these symptoms as indicators of a more severe infection. Moreover, the study highlighted that older adults often present atypically, sometimes lacking classic urinary symptoms, making fever and chills crucial diagnostic clues in this population. Recognizing these signs early is vital. If you or someone you care for experiences unexplained fever and chills, especially without other common UTI symptoms, it's essential to seek medical attention promptly. Early intervention can prevent complications and ensure effective treatment. Next, number 11. Nausea or vomiting. When a urinary tract infection spreads to the kidneys, a condition known as pyelonephritis, it can lead to systemic symptoms, including nausea and vomiting. This escalation occurs because the infection triggers an inflammatory response throughout the body, affecting various systems beyond the urinary tract. The kidneys, when infected, release pro-inflammatory cytokines into the bloodstream. These cytokines can stimulate the chemoreceptor trigger zone in the brain, leading to sensations of nausea and episodes of vomiting. This mechanism explains why gastrointestinal symptoms often accompany more severe urinary infections. A 2024 review in the American Journal of Kidney Diseases emphasizes that nausea and vomiting are prevalent symptoms in patients with pyelonephritis, underscoring the systemic nature of upper urinary tract infections. This highlights the importance of recognizing these symptoms as potential indicators of a more serious infection requiring prompt medical attention. Next, number 12. Painful intercourse. Pain during intimacy can be more than just a fleeting discomfort. It might signal an underlying urinary tract infection. When bacteria invade the urinary tract, they can cause inflammation and irritation, leading to discomfort in areas like the urethra and bladder. This irritation doesn't just make urination painful, it can also make sexual activity uncomfortable. In fact, a study presented at the 2023 menopause meeting of the North American Menopause Society highlighted that 83% of women diagnosed with UTIs reported experiencing pain during intercourse. This symptom, known as dyspareunia, was particularly prevalent among premenopausal women, yet it often goes unrecognized in clinical evaluations. The discomfort arises because the infection inflames the urinary tract tissues, making them sensitive. During sexual activity, pressure on these inflamed areas can intensify the pain. Recognizing this symptom is crucial, as it can lead to timely diagnosis and treatment of UTIs, preventing further complications. If you've noticed pain during intercourse, especially if it's accompanied by other signs like frequent urination or a burning sensation, it might be time to consult a healthcare professional. Addressing these symptoms early can make a significant difference in your comfort and health. Next, number 13, feeling tired or shaky. Waking up drained, even after a full night's sleep, can be frustrating. If you're also feeling shaky or weak, it might not just be stress or a busy schedule. These symptoms can sometimes signal a urinary tract infection, especially in older adults. UTIs are commonly associated with symptoms like burning during urination or frequent urges to go. However, in seniors, the signs can be more subtle. Fatigue and a general sense of unwellness are often overlooked indicators. This happens because the body's response to infection can differ with age, leading to less obvious symptoms. A study published in Scientific Reports in 2022 found that over 50% of older adults hospitalized with a UTI didn't exhibit the typical urinary symptoms. Instead, they presented with atypical signs like fatigue and weakness. This atypical presentation can delay diagnosis and treatment, potentially leading to more severe complications. If you're experiencing unexplained tiredness or shakiness, it's essential to consider all possible causes, including UTIs. Consulting a healthcare provider can help determine the underlying issue and ensure appropriate treatment. Next, number 14, confusion or delirium. In older adults, infections don't always show up the way you'd expect. Instead of a fever or pain, they might suddenly seem confused or disoriented. This abrupt change can be alarming, especially if it's mistaken for dementia. The culprit? Often, it's a urinary tract infection. UTIs are common in the elderly, and they can trigger a state called delirium, a sudden, severe confusion. Unlike typical UTI symptoms, this doesn't involve pain or burning during urination. Instead, the person might become agitated, withdrawn, or have trouble focusing. A 2022 systematic review published in Curus highlighted this connection. Researchers found that UTIs frequently present with atypical symptoms in older adults, such as confusion, dizziness, and drowsiness, often without the classic signs like fever. This makes diagnosis challenging, as the usual indicators are absent. The review emphasized that delirium is a common atypical presentation of UTIs in the elderly, underscoring the importance of considering UTIs as a potential cause when sudden cognitive changes occur. Recognizing this link is crucial. If an elderly loved one suddenly becomes confused, it's essential to consider a UTI as a possible cause. Prompt medical attention can lead to appropriate treatment, often resulting in a full recovery from the delirium. And that's it for today's video on the hidden and not so hidden symptoms of urinary tract infections. If you learned something new, or this helped you recognize what to look out for, don't keep it to yourself. Share this video with someone who might need it. We're here to make health simple, real, and backed by science, and your support means everything. If this video was truly helpful, type "helpful" in the comment box below. It lets us know we're making a difference, and it fuels us to keep bringing you more powerful health content every week. Don't forget to hit like, subscribe, and tap the notification bell so you never miss what's coming next. Until next time, stay informed, stay healthy, and always listen to what your body is trying to tell you. Take care.